HIV is a virus that attacks cells that help the body fight infection. One of the biggest challenges in the fight against HIV isn't the virus itself, it's stigma. Even though modern medicine allows people living with HIV to live long, healthy lives, judgment and discrimination still exist because people are misinformed about the virus. These barriers don't just hurt people emotionally, they can actually make HIV harder to prevent and treat. Sometimes stigma is obvious. A person may be denied opportunities, treated unfairly, or excluded because of their HIV status. Other times it's more subtle. People may make assumptions about how someone became infected, treat a person differently after learning they have the virus, or avoid talking about HIV altogether. Many people still think HIV is a death sentence, or that it's easy to spread through everyday contact. Neither of these things are true. But when misinformation goes unchallenged, stigma continues to grow. Stigma might seem like a social issue, but it has real public health consequences. When people fear being judged, they might avoid getting tested, or if someone doesn't know their HIV status, they won't access treatment. Others may avoid discussing HIV with partners, friends, or healthcare providers. The result is that stigma creates barriers to prevention, testing, and treatment. In other words, stigma can actually help HIV spread. Part of reducing stigma means understanding the facts. HIV stands for Human Immunodeficiency Virus. It attacks the immune system, and if left untreated can eventually lead to AIDS, which is the most advanced stage of the virus. Thanks to modern treatments called antiretroviral therapy, managing HIV means taking medication every day and attending routine medical appointments. That's all it takes. Perhaps most importantly, HIV cannot be spread through hugging, kissing, sharing food, using the same bathroom, or casual contact. The more we understand HIV, the less room there is for fear and misinformation. One of the most important discoveries in HIV research can be summed up with just 3 characters. U equals U, which stands for undetectable equals untransmittable. When a person living with HIV consistently takes their medication, the amount of virus in their body becomes so low that it cannot be detected by standard tests. People who maintain an undetectable status cannot sexually transmit HIV. Yet many people still don't know this fact. And when public understanding lags behind scientific reality, stigma continues to persist. To understand why HIV stigma still exists today, we have to look at where it came from. When HIV emerged in the early 1980s, it disproportionately affected gay men in the United States. As a result, many people labeled AIDS as a gay disease. Fear and misinformation spread rapidly. Homophobia influenced public attitudes toward the epidemic, and many people living with HIV faced discrimination, rejection, and isolation. The stigma became attached to not only the virus itself, but also to the communities most affected by it. While medicine has advanced dramatically since then, so many of those attitudes still linger today. That's why knowing the facts is so important. Challenge the fear, misinformation, and discrimination that continue to affect people living with the virus. Spread the knowledge, have open conversations, advocate for access to healthcare, regular testing, and community support. Because ending HIV isn't just about developing better medicine, it's about creating a world where people feel safe enough to use it. Reducing stigma helps people get tested, it helps people seek treatment, it helps people live openly and honestly, and ultimately, it helps improve public health for everyone. The fight against HIV has always been about more than a virus. It's about how we treat one another. Science has transformed HIV from a fatal diagnosis to a manageable condition. Now the challenge is making sure public attitudes catch up with the science. Because if we want to reduce HIV transmission, improve treatment outcomes, and support people living with HIV, we have to address stigma too.